cardiac blood will come out from the heart so that it will supply all over your body, so that you get an oxygenated blood to have energy in your body, right? Next is the people will have a chest pain. I told you that which particular blood vessel is being affected, based on that you will have a symptom, right? So if the cardiac blood vessels are being affected, definitely what will happen? The cardiac muscles will not receive an adequate blood supply. So immediately there will be a mechanism, we just say that immediately anaerobic mechanism will be taking place. When there is an anaerobic mechanism, lactic acid will be produced. The first symptom when the lactic acid is produced in your body, pain. So that the patient will have a pain, people will have pain, and people will have an irregular heartbeat and palpitations. See, usually you can't feel your heartbeat, right? Normally we don't feel our heartbeat. But whenever we are exposed to stress, whenever we have a problem, so people will have palpitations and their irregular heartbeat. So when these are warning signs, right? And so these are the blood in the urine and all last stage. That is if you have any kidney diseases exposures, if you have it. So, what I should do if I have the symptoms? What should I do? When you go to the hospital, first thing is, please approach the medical practitioners, doctors, or a hospital, go there. Do not hide anything. That is the first thing. Do not hide anything when they collect the history. First question, do you have any family members with hypertension? Agree. Don't tell such kind of things. See, we are human beings. We are prone to develop disease. Please try to understand. Right? So what is truth? Please ventilate to the medical fraternity. So they will be asking you, do we have any palpitations? Do we have any breathing difficulty? Do we eat what kind of food? Every day we take junk food without knowing what is junk food. And when the doctor asks, no, I never take junk food. Only the home food I will take it. Right? So such kind of things should be avoided. They will ask you that when you climb a step, do you have any breathing difficulty? When you climb staircase, do you have any pain? If you get a pain, is it been radiating to any other area? And if you get up in the morning, do you have a headache? Is it the headache is on the occipital back? It is on the back, isn't it? And if the pain is having the shoulders of your body, or the pain is having a neck. See, neck pain, please, it is not that always BP. There will be a cervical spondylitis also, you will have a neck pain. And so sometimes morning, even after complete rest, when you have a headache, especially the back of the headache, not the frontal, it is at the back, and when you have your neck pain, so these are the warning signs. When they ask, you tell all these things, right? So what they will do as a physical examination. Examination means you tell that if you have any eye problem, right? Because this hypertension will affect your heart, your kidney, your brain, your all vision and your peripheral nerves. These are the major 5 organs will be affected. Kidney, first is heart. First is heart in terms of heart attack. What happened here? Anything?
No.
In the form of heart attack. Cardiac arrest we call it as. When it comes to nervous system, stroke, you all would have heard it. One side weakness, one side failure. Your hand is not working, your leg is not working, the person is unable to speak. So such kind of things. So that is stroke. Kidney diseases, kidney failure. The fourth is vision, complete vision loss. We call it as glaucoma. And finally your peripheral blood vessels. So that is 5 major organs it will affect without giving any symptoms. By the time when you go to the doctor, 50% of the organs will be getting damaged. Can you understand what I am talking? So When you have the small symptoms, simple manifestation, please proceed to your doctors. And they will be measuring your blood pressure. So what after that they will do it is, they will be measuring your blood pressure. Allow them to check. When blood pressure check panna vendam. Please have it checked. Right? And for one time, if you check your BP is high, thinking again, it will increase your BP. Be normal, right? So because I told you that it is a persistent elevation of your blood pressure. Is it okay? So that again, and we have to completely do all your blood counts, your blood glucose, because I told you already that twin diseases, right? Blood glucose need to be checked, and your routine urine investigation, and all the cholesterol levels. Total cholesterols, we will be checking your HDL, your LDL, isn't it, triglycerides, all these things will be checked, and if your cholesterol is above your 250, for a normal person it is being increased. If it is a people with hypertension and the diabetes, known people, if it is above 200, again it is risk, so we need to understand. Next year, ECG, that is the first thing. If you have a pain, if it is a pain which is being radiated, then you have a sweating. When you have sweating, see, there is a difference between normal heart pain, cardiac pain and gastric pain. That you are supposed to understand. Because both the symptoms it will mimic. We call it as a mimicking. They are twin with brother symptoms, we call. So they will mimic, right? So, but few symptoms in a cardiac thing, early morning it will come, right? And it will have a perspiration, means sweating, excessive sweating, diaphoresis, and they will have a palpitation, and this means difficulty in breathing. These kind of things, and your body will become chill. Why your body will become chill? We call it as a cold and clammy skin, because when the blood pressure is being increased, so your body your heart will think, let me give blood supply only at least to the vital organs, not to the non-vital organs. So what are the vital foremost organs are your kidney, your brain, your heart. So those areas only it will give the blood supply. It will not provide blood supply to the skin. So that's the reason the skin will be cold and clammy. These are the cardinal sign you just think of when you have, and your pain which is being radiated. What type of pain? See, when we wash up cloths, we'll squeeze the bed sheets, right? So we'll squeeze. So throbbing kind of pain, your squeezing kind of pain, the people will have an exposure. So such kind of things, immediately you should ship them to the hospital. The first thing is the patient supposed to undergo for an ECG. Then we can go later, echo and X-ray, that will show any cardiac, any structural abnormalities are there in the heart, that will be evidenced with the help of echo. Okay, next is your, so you're clear with the investigations, what you're supposed to undergo? Yes? So even the physician is telling no also, please hereafter, if something warning, please tell all this. Okay, so once you have been diagnosed with hypertension, don't feel bad, first of all. People are hesitant to tell outside that you are hypertensive. Nothing wrong. See, when developed countries, abroad countries, everywhere there is a bracelets. Medi-alert bracelet will be worn by the patient stating that I am diabetic, I am hypertensive. Why? Because others should know something happens to me, what is the right treatment supposed to be given to the patient for that. But here people are hesitating to tell that outside that I am diabetic, I am hypertension. We have not done any mistake to get this disease. Please try to understand. Isn't it? These diseases are not stigmatic diseases. So first thing is, when you are being diagnosed with hypertension, regular blood pressure monitoring. Never ever avoid it. Regularly you have to, sitting, lying, standing, all these positions you have to have a blood pressure monitoring. regularly, at least 15 days once, and administer prescribed medications by the doctors to control. What is the normal behavior of our people is, it is not the fever, it is not the thing. Till the fever goes, you take the medications and will not administer medication. That is normal. But here people will, what they'll do is, they'll take one normal behavior, stop our people. Next visit also they will not go to the doctor. No, that is completely wrong. Fever, it is not the person must be diagnosed 3 years before and maybe have taken 6 months, then completely stop the medication. Many patients die because of those reasons, or many patients develop complications. Next visit also they will not go to the doctor. No, that is completely medical compliance. Person must be that is a major thing. So please try to understand. So whatever the medication, the physician is in order, has to be taken. Blood pressure, hypertension cannot be cured. Please try to understand. Hypertension cannot be cured. Maybe control. Even the medication milligrams or the type of medication supposed to take, it should be decided by the physician, not by you or me at home. Please try to understand. Hypertension cannot be cured. We say this is happening. Even the medication milligrams or the type of medication supposed to take, it should be decided by the physician, not by the modification of the drugs or a combination of the drugs. It will be decided by the medication. What we take from this is to be done by the medications, all supposed to be completely done by you and me from the what are those inside lifestyle modifications? So I have given 6 drugs, height reduction, dash, that is what we take from this moderation of alcohol consumption and tobacco use. That is all supposed managing the psychosocial and need from what are those inside lifestyle modifications? So I have given 6 drugs, height reduction, dash, weight reduction. That is what we take moderation of alcohol consumption and tobacco use. That is why there is a post managing the psychosocial and need. One is sedentary lifestyle. It doesn't do any heavy weight reduction. Especially teachers, professors, and IT people. Those people are leading a sedentary lifestyle. When you sit for a sedentary lifestyle, normal glucose will be converted into fat, heavy, and that will be deposited in the tissues of the body, wherever there are normal places the fat can be deposited in the body. Leading a sedentary lifestyle in the form of fried things. Instead of it, take fruits and vegetables as a snack. That is what your American Heart Association is advising it, because these fruits and vegetables are having a lot of fibers, because this will be converted as a high density lipoprotein. So we need only the high density lipoprotein, not the low density lipoprotein. So it will be able to pick up your fat and it will go and deposit it in the liver. Liver will be eliminated by doing a metabolism. Right? That's a simple logic. So consume lot of fruits and vegetables because it has more amount of fiber and lot of vitamins. And as per the American Heart Association, 5 servings of fruits supposed to be taken per day. Per day. So thinking of developing country like us, right? So don't think of, see, they have mentioned all the colorful fruits because these colors, it has lot of antioxidants. That is what they say it is. Your capsicum, if you see red, yellow, green, isn't it? Purple fruits, kind of things. Why the colors? In tomato we have a red, cherry red. So the dark color fruits they recommended because the color has more amount of antioxidants. And when you have a meal, have a small quantity of rice, maybe 100 or 200 grams of rice, and complete of your fruits and vegetables. See, I am not saying about the high costly fruits like your very, very costly fruits. I am talking about the Indian fruit, Indian gooseberry, Indian amla, and your guava, right? So what is available locally, such kind of fruits can be consumed in, right? Next, the DASH diet. Eat fish twice a week. See, please better avoid the red meats. So the red meats are beef, pork, isn't it? Mutton, beef, pork are red meats. So what is the Indian culture? When we have a rice, so much of gravy we'll put it on there and we'll eat it. So even developed country people, they'll also eat, but they'll have a slice with lot of vegetables. They'll add it and they'll eat. But we never consume vegetables. Instead of it, only the meat we consume. So avoid the complete red meats. And even a poultry items, when you consume it, even poultry items, weekly once you can have it without skin. Right? Without skin you can have it, the poultry items. And fish. Fish is very good for your heart. Please try to understand, because it has your less amount of triglycerides and more amount of HDLs. So omega-3 fatty acids, even your flax seeds, your fish, especially the fishes, the small fishes, your tuna fish and your mackerel. In Tamil we call it as matti, right? And salmon fishes. So such kind of fishes, and then the fish which have more amount of calcium. What is it? Nethylene, right? So these kind of fishes can be consumed because more amount of calcium. So fish is always good for heart. So when you consume fish in a week, so automatically your HDL level will increase it. So when you have a HDL more, it will be able to destroy more amount of fat. So if, say, I don't eat fish, but I wanted to increase my HDL level, so you can have your fish liver oil and cod liver oils. So the cod liver oil and fish liver oil is supposed to be referred by your physician based on the value of your cholesterol. You cannot choose by your own. When you go to the market, there are a lot of fish liver oils in a different brand which has been coming. So better you consult your physician based on the physician order, you just consume it. Next, check your salt habit. Because salt, why every time in a BP, when you go to the doctor, first thing, when right? That is the first thing they will say it is. What is the reason? Till now there are a lot of researches which has been going on, but salt is the one, your sodium is the one. Salt, the normal salt, sodium chloride which we eat, the sodium is the precursor for retaining evaporation. It will not directly affect it because it acts as a precursor, it will absorb the water. So it will retain more amount of water. Whenever the water retention is more, the heart will have a difficulty to pump much so that your blood pressure will increase it. So as per the American Heart Association, it will be limiting your salt 2.3 milligram, 3000 milligrams, or we call it as 2.3 grams daily. We consume 10 to 12 grams. You know it? Yes. That is what always we say it is. Okay, I'll finish it. Okay, that's a heavy salt. So restaurant foods and the tin foods, please avoid. Tin foods, all the packed foods. Next is, you all would have been surprised why madam had put the girls smoking. Because that is only trend nowadays. Boy smoking is common, right? Men smoking is common, girl smoking is trend, right? Okay. See, sometimes medical people talk many things openly. Because like this, when I was talking to the one of our sister concerned regarding the breast self-examination. So after that they were asking, ma'am, very openly you're talking everything. Like, because sometimes when I saw certain things, please give me a hint, right? So smoking is a major risk factors because smoking content, your nicotine is playing a major role for constricting your blood vessels. What your nicotine will do is, nicotine will constrict, the whole length is like this, means it will, the width will be reduced. So that's the reason we always, dangerous than alcohol you are smoking. Please try to understand. Smoking is very dangerous than alcohol consumption. So if at all smoking, if anybody, if you found, stop right now, not after a week, not after a month. I will decide, no, you have to stop right now. Stopping smoking is very difficult because when you stop suddenly, alcohol and smoke, people will end up with withdrawal symptoms. So, kaiyala nadungu, withdrawal symptoms. Isn't it? Or a smoke pannittu vandana sariyagum. Because the immediate pleasure, because of the sympathetic nervous system will activate this, their blood pressure will increase, they will get the blood supply to the brain. That is the physiology. Right? That is the physiology behind it. But that is the reason we say do not stop abruptly. Smoking cessation sections for a period of 6 months they can take it. And for example, per day, if a person is having 5 cigarettes per day, so person can reduce it 3 in the initial. And they can think of weekly and monthly, like that 6 months smoking cessation period. If at all the person is unable to reduce it, the counselors, they can approach the counselors. They will tell you the other alternative medicines and therapies or remedies to overcome that, like your nicotine syrup, nicotine tablets, nicotine chewing gum, nicotine chocolates. So all these things, and along with that meditations, all these things can be tried, right? Limit alcohol. So when there is in developed countries, if you think of United States and UK and all, because of the weather, people feels very cold and they consume hot wine. Wine is allowed, that is a glass of red wine is allowed, that is for 1 ounce. What is the quantity of 1 ounce? What is the quantity of 1 ounce? 30 ml. 1 ounce is 30 ml. Our people will have? Yes. So the advisable is only the red wine, 30 ml per day is being advised because this wine is having lot of phenaldehydes which is helpful for your purifications of your blood, right? But what it has been available in the market or a task market, please stop all those things because it affects all your blood vessels. So next is get more exercises. Now another thing, to reduce your weight, reduce your BP, to reduce your heart disease. So how should what madam, I cannot go for a jogging, I cannot go for a running. No, walking is enough. The normal walking for a period maintain the elasticity of the heart. Right? So exercise, what is the WHO is recommending, World Health Organization is recommending is 30 minutes brisk walk for 5 days. 30 minutes brisk walk for 5 days. So what is meant by brisk walk? So your right hand, when you are swinging front, your left leg should go up. When the left hand goes up front, your right leg should go front. With brisk, you should have a perspiration. That means you should have a sweating. Right? So the normal brisk walk for a 30 minutes in a day for a 5 days in a week is enough as per the World Health Organization. If you are not doing that, then all this problem we have to exposure. Next is, I'll finish 2 minutes. To control the stress. So when you have a chronic stress, what will happen is our body will release or increase more amount of cortisol. So this cortisol is the one which increases, cortisol hormone will increases blood pressure, stroke, all these things. So never ever expose stress. No, we have to expose stress. But we should know how to manage stress. Because from the school children, from the child who is born in the world till the death, we are under stress. But we should know how to control the stress. So the controlling the stress is, so there are a lot of measures. Walking is the first thing. Your exercise. Your deep breathing and coughing exercises. Take a deep breath for 30 minutes or 20 minutes take in a day. Meditation morning and evening, yoga, exercises, definitely your stress level will, or have a good friend of yours. Share thoughts, whatever you have. Right? And the final thing for the youngsters or nowadays even olders. This is another thing, get enough sleep. Many of us are sleeping after 12 o'clock, after 1 o'clock, midnight. Some persons, if you see that, madam, morning 3 o'clock only I go to bed every day. What time you will wake up? 10 o'clock I will wake up. That is the fashion nowadays. 10 o'clock getting up children nowadays, right? So avoid all the kind of things because of the gadgets, right? So get enough sleep. We need to follow our biological clock. We have a biological clock inside the body, right? It will say it is 10 o'clock, go to the bed. Because I should start working. When you calm, your kidney will function, your liver will function, your brain will take rest. So all this instruction your brain will give it. So we need to follow the biological clock which is there inside our body. Right? So get enough sleep. So when we follow all this lifestyle modification, definitely we will be able to maintain our blood pressure normally. Thank you for the opportunity. Any queries, any questions? Please take this message to everybody so that we can prevent heart diseases, neuro diseases, and if you have any queries, please.
ரொம்ப அழகா தெளிவா உடல் ஆரோக்கியத்தை பத்தி சொன்னீங்க. இப்போ நம்ம ரத்த பரிசோதனை, யூரின் டெஸ்ட் எல்லாமே ரொம்ப பேசிக்கா ஒரு 45 இயர்ஸ் இந்த ஏஜ்க்கு அப்புறம் என்னென்ன டெஸ்ட்லாம் எடுக்கணுங்களா, எவ்வளோ இயர்ஸ் ஒன்ஸ் எடுக்கணுங்களா, 3 இயர்ஸ் ஒன்ஸ் டெஸ்ட் எடுக்கணுமா?
First of all, the screening, that is what she is asking. The screening is supposed to start from 30 years. Don't think of 40, 45. See, the recent days heart attacks are starting 28, 25, 30. So, total body screening. So, that is what we call it as master health checkup. See, certain diseases, your breast examinations, your kidney diseases, certain, according to the organ, we will have a different ranges. But when you wanted to go for a master health checkup, please start in the age of 30. So we'll have a packages, the total cholesterol, total blood count, your total ECG, X-ray, your echo, isn't it? So all these basic investigations, they will physicians, so based on their physicians you will do. The screening is supposed to be start from the age of 30. Please keep it in your mind. Apart from that, if you have any symptoms, certain symptoms I told you, dizziness, giddiness, sweating, you're overweight. If you have overweight, please check regularly your BP and sugar. And yearly once master checkup is mandatory. And females, those who are in the reproductive age, we call it as your 18 to 45 is the reproductive age. In that, it is mandatory to have your breast mammogram and your vaginal examination, your pap smear, every year after 30. Additionally, clear, Akshinla?
Ma'am, you told that 80 by 120 is a pressure normal. But you mentioned that 80 by 120, if it is below that, it is good. 80 by 120, you are in
optimum normal. Your optimum normal is that you are expected to be like that.
Then when you will say it is a low pressure.
Low pressure. 60, below 60, your diastolic value below 60, your systolic value below 90. 90 bar 60. That is again dangerous. Please check. When you have low BP 90 by 60, so immediately the management is hydration. ஞாபகம் வச்சுக்கோங்க, யாருக்காவது பிபி கம்மியாகி அங்கே விழுந்துட்டாங்க, டக்குன்னு செக் பண்ணுறீங்க அப்படின்னா, உங்களுக்கு பிபி லோ பிபி நார்மலாகவே இருந்தால் ப்ளீஸ் டெல் டு யுவர் ஃப்ரெண்ட்ஸ், எனக்கு நார்மலாகவே லோ பிபி, எனக்கு நார்மலாகவே ஹை பிபின்னு உங்கள் சரௌண்டிங்க்கு ப்ளீஸ் கிவ் அவேர்னஸ். ஹைட்ரேஷன் ஃபஸ்ட்டு என்னன்னா லோ பிபியாக இருக்கிறவங்களுக்கு இம்மீடியட்லி ஹைட்ரேட் பண்ணுங்க, ஜூஸ் வாங்கி கொடுங்க, ஃப்ளூயிட்ஸ். இஃப் த பர்சன் இஸ் கான்ஷியஸ், பர்சன் கான்ஷியஸாக உங்களுக்கு ரெஸ்பாண்ட் பண்ணுறாங்க, அவங்களால குடிக்க முடியும் அப்படின்னா இம்மீடியட்லி யூ ஜஸ்ட் கிவ் த ஃப்ளூயிட்ஸ். ஃப்ளூயிட்ஸ்ன்னு தான் நான் சொல்லுவேன். ஏன்னா அவங்க ஒருவேளை ஹைப்பர்டென்சிவாக இருந்தாங்கன்னா நீங்கள் உப்பு போட்டு கொடுக்காதீங்க. புரிஞ்சுதுங்களா? ரைட்? நான் ஃப்ளூயிட்ஸுங்கிற யூஸ் பண்ணுற வார்த்தை, நீங்கள் அவங்களோட கண்டிஷன் என்னன்னு பார்த்துட்டு, டயபெட்டிக் இல்லைன்னா உப்போட கொடுங்க. Otherwise, if a person is not conscious, if they are not responding, they are not oriented, உங்களுக்கு எந்த இடத்துல இருக்கே நீங்கள் ஒரு கொஸ்டின் கேட்டிங்கன்னா, when they are unable to give answer அப்படின்னா, immediately you have to shift to the health facility எங்கே இருக்கோ, you have to shift it, and IV fluids in the form of fluid will be administered to them.
இப்போ அயோடின் சால்ட், ராக் சால்ட் ஒரு டிஃபரன்ஸ் என்ன மேம்? எது பெட்டர்னு நீங்கள்
Actually, being an allopathic professional person, always I prefer the reduced salt. Always the Tata, what is it? Iodized with low sodium salt, light salt, which has been there, no? Light salt which has been coming. That is sodium level supposed to be less. But if you go to homeopathy or other kind of things, no, they will say that you have to roast your. See, that is all. Research wise, it is not proved. Please try to understand. If research is there, we can follow. Evidence is there, we can follow. Right? If there is no research findings, we cannot follow.
Okay, thank you.
Thank you so much. Thank you.
Healthy and happy heart hereafter. So I request that will continue to propose those things.
Good morning everyone. It's my honor to deliver a vote of thanks at the conclusion of today's meaningful and informative session on hypertension. Thank you, ma'am. First and foremost, I would like to express our sincere gratitude to the management of NGI for providing us with the platform and resources to organize this expert series, and a heartfelt thanks to our respected principal Dr. B. Vijay Kumar sir for the valuable guidance and encouragement. We are truly grateful to our distinguished speaker Dr. C. Fiona Esther Tanga ma'am for valuable insights on hypertension. Thank you ma'am. Your talk has surely raised awareness and left a lasting impact on all of us, and also let us carry forward today's message that good health begins with awareness and action. Thank you once again and have a healthy day ahead. Thank you.